Hi, my name is Lord Cabahug, student number 3031370, currently taking the PN program in NFDN 1002, and I'm going to be showing how to properly uh, change and apply a new transdermal patch. So the first thing I need to do is to perform hand hygiene. Next, I need to provide the patient some privacy. Next, I need to introduce myself. Hi, my name is Lord Cabahug. I I'm going to be your practical nursing student today, and I'm going to identify the patient with two identifiers, such as their first and last name and their date of birth. So, what is your first and last name, Miss Catherine? Okay, thank you. Next, I will ask Catherine for consent for doing my set of vitals. So, Catherine, I'm just going to do a set of vitals first before I do anything else. Is that okay? Yes. And before doing my vitals, I'm going to readjust the height of the bed and put the side rails down to make it to a comfortable working height. Next, I'm going to be getting Catherine's temperature, pulse rate, respirations, SpO2, blood pressure, and do a pain assessment if it applies. Sorry. Next thing I'm gonna do is that after I get the set of vitals and everything, I will ask Catherine if she has any kind of allergies. If not, that's good. I can proceed to the med cart to get my to get the medication that is prescribed by the doctor. Before I leave, I'm gonna put the bed to the lowest possible setting, put the guardrails up, make sure call bell's in place, and I'm going to the med cart. So at because my place is kind of small, I don't. This is like my med cart, so I'm just gonna say everything that I'm doing here first. Because this is a transdermal patch, I will be do I will be involving the narcotic count sheet. So first, I am seeing the doctor's orders and making sure everything matches with the MAR. After that, I'm getting the narcotic count sheet and I'm counting each and every nicotine patch that is available. And I'm going to put the number down and going to sign. After doing the narcotic count sheet, I am getting the medication. I'm getting this nitroglycerin patch, and I am preparing it there on a table or on a tray. But before I do anything, gloves are very important in this and this type of medication administration. But I don't have gloves right now because I forgot to buy some. So yeah, at this point I would wear gloves, but sadly I don't have any, if that's okay. So yeah, I would wear gloves here. I would get the medication and I would proceed with my three my five writes and three checks. So against the MAR, I would cross-reference it with the MAR. So if it's the right name, the right medication, the right dose, the right route, the right time, and the expiration date. Okay, everything seems to be in order. So with gloves, I am also rechecking it, doing my second round of checks, and I'm opening the medication. Yeah, medication. I'm preparing on the tray, and I am still again referencing it to see if the MAR is correct. To see what I'm to prevent medication errors. I am checking again the right name, the right medication, the right dose, the right route, the right time. And as I'm putting everything away, I'll be throwing the paper. I am still doing my last round of checks. If it's the right name, the right medication, the right dose, the right route, and the right time. And at this point, I would write my initials and the date for the new patch, not on the sticky side. So on the bedside table of Miss Catherine, I'm bringing the I'm bringing the new patch in and everything. Sorry, my throat's really dry. So on the side of on the bedside of Catherine, I'm going to do the last of my 5 rights. This is the right reason. So the right reason, last example, Miss Catherine is taking this because she has nicotine. She used to have a nicotine addiction, and she will be experiencing withdrawals now that she's in the hospital and can't smoke that well. So, I'm sorry. So the right to refuse. So if Miss Catherine doesn't feel or like doesn't want the signs and symptoms of the nicotine patch, she's always allowed to say no. I'm just going to put that down in my documentation, or I will call the physician if there's any alternatives that I can give her. Their education. So their education for a transdermal patch is that to tell Miss Catherine to like not touch the patch, to not apply pressure, or yeah, just leave the patch alone. I'd say, or don't heat the patch is what I would say. And for my documentation and my evaluation, I will come back in an answer of usually medication takes about 30 minutes of the medication onset takes about 30 minutes. So I will come back then and I will do my last set of assessments. So be so before that, before applying the new medication in, I will look for the old transdermal patch and I will take it out and I will fold it in half in both places, remove my gloves, and I will throw them to the appropriate recycling bin. And I will wear new gloves. Then I will apply the transdermal patch, which has my the date and my initials, date, time, and initials. Yeah. Oh, and before doing any of this, make sure the bed is in a comfortable working height and the side rails are down, just to prevent future back pains or anything. So with my gloves, I am applying the new transdermal patch, not on the same site. Maybe on here on his chest, making sure it sticks. Or on the, actually I'm just gonna apply it to the right side of the thigh, if she's comfortable with that. Just to prevent any type of friction between the patch and her arm. So after this, I'm going to be asking Miss Catherine if she needs anything else, if there's anything I can do for her, or she needs anything else. If not, I'm going to be leaving her with the bed at the lowest possible setting with the side rails up and the call bell in place. Then I'm going to do my last set of hand washing. Then I will leave and be back on about 30 minutes to see how the effects of the medication worked, or yeah, I will be seeing if the effects of the medication did work. So that is how you do remove and change the transdermal patch.